Hello there and a very warm welcome to yet another edition of the Spotlight. Now it is crucial and important to discuss the critical role that a healthy lifestyle and healthy diet plays in our overall well-being of life. Now as we navigate through different stages of life, from childhood to adulthood, things vary. So it's important that we discuss and analyze the importance of having a healthy lifestyle and moving on into a healthy diet as well. So there is no better person to talk about this. We have had him on the show before as well. Surgeon, Rear Admiral and former Director of the General Navy Health Services, Dr. Lalith Ekanayake. Thank you, Doctor, for joining us.
Thanks, Varela. Thanks for having me today, and as well as we had a kind of a discussion few months before.
That's right.
Yeah, thank you very much.
Lovely to have you back in the studios, Doctor. And today, as I mentioned, we're talking about the importance of having a healthy lifestyle and also being fit and also a healthy diet, because these are important things in any person's life, Doctor.
Of course.
So I think we would like to hear from your aspect. How important is it?
Well, you know, Mariela, we need diet to live, you know. We need to eat and healthy food to live. And also we need to do exercise to maintain it. Otherwise, so we need to have balance in between these two. So healthy diet is, what is healthy diet? I mean, people talk about various things, but basically the healthy diet need to contain proteins, carbohydrates, vegetables, fruits and kind of thing, and also the component of fat, of course, of the micronutrients and so on there, definitely. So usually the healthy diet contain about 25% of high fiber carbohydrate and also 25% of proteins and about 40% of vegetables and about maybe about 10% of fat and the other sugar kind of thing. And why I stress that point is high fiber carbohydrate is, it is very important. Refined carbohydrates are not good. It absorbs pretty fast. And
Doctor, refined carbohydrates?
Well, I would say it is basically our diet contains a lot of rice, you know, especially the polished rice. It is a refined kind of a carbohydrate, and also all these bakery products are refined carbohydrate. That's why they are very tasty and very palatable. You can eat any amount, you know. But of course, the bad effects are more, you know. It has got a lot of calories, and it absorbs slowly. And it is not healthy, you know, and also it increases your weight, so that is not good. So therefore, high fiber carbohydrate is the most very important. So about 25% of carbohydrate, 25% of proteins, and 40% of vegetables and the fruits, and the 10% of fat and the sugar. That is the balanced diet. So in Sri Lanka, those components are there. I mean, I don't think so, because if you take a packet of rice, 70% of our packet of rice is rice actually. We normally call it bath packet, right? No, that is contained about 70% of rice, and the rest of the thing are the vegetables and the fish and that kind of thing. But it has to be the other way, you know. That is the very reason some people, they are having their weight increase, and also they are prone to get more and more diseases and kind of so. So balanced diet is very important, and I'll tell you how to maintain your lifestyle.
Doctor, one might say, I think one might say, I'm not having any diseases such as pressure, cholesterol, diabetes, and they continue eating, you know, junk food, bakery items and so. And I think most often also a lot of Sri Lankans wait till you fall sick to start having the right sort of food and meals. But I think even before you get into that stage, why not start having a healthy diet even earlier than that?
Yeah, that's right. It is like this. Now people ask me most of the time, how do you maintain your weight, right? Because it is like, the example what I give you is, it is like you driving a vehicle. It is very easy to go forward. The reverse is difficult, because the moment you start eating, you start increasing your weight, but the reverse is difficult. So it is important to maintain from the beginning. So my advice is, I mean, there are various what you call the patterns of diet patterns, you know. People say what you call the long fasting and take a break and have your diet. But my personal feeling is have small frequent meals rather than having big meals. So it is very important to have small frequent meals all the time. Let your stomach half fill. Whenever you go and eat your meal, you are not hungry, right? But you eat something, just to fill up your stomach. So that is how you maintain your diet and also the weight.
So today, doctor, we are diving into different stages. Childhood, we will be talking about diet and lifestyle for childhood, during the childhood period, for the adults, the older adults, and also we will touch a little bit about pregnant moms as well. So doctor, starting off with children and adolescents, is there a specific pattern for them? Or as often say, children are young, they are healthy, give them what they want to eat, they will recover in time?
It has to be the other way. Because I feel that, and they have found that diabetes, high blood pressure, and most of the disease starting from the adolescence, It is better to give a balanced diet to the small children as well, especially school children. And I know that most parents are busy. They tend to buy the stuff from when they're going to school or something on the way to school, But most of them, all the foods are very high in calories and low in volume, The absorption is pretty fast. For a short period is okay, off and on, but in the long run is not good, But they are contain a lot of calories, because the daily requirement of calories is about, adult male is about 2,500, female is around 2,200, and the children is less, Especially the adolescents, the age like 10 to 15, that is the time they tend to eat more and more food, junk food and kind of thing, and that is the time they start their diabetes, and also high blood pressure. We have seen in the school children with diabetes and also high blood pressure. So I think from adolescent, from the childhood, I think you need to control your diet. It is very important message to all the parents. I know that you love their children to be chubby and kind of thing, but that is not anymore. If they are healthy, if they are active, give a simple basic diet which contain good protein and less carbohydrates, got a lot of vegetables, and less sugar and less fat. It's applicable to, irrespective of those, it's applicable to all ages.
Doctor, now when we talk about children, I think especially in this age category, it is important that we talk to the parents about this, because the children sort of have no control as much as the parents do. So as you were mentioning, it is important that the parents encourage this sort of healthy pattern in the life of a child. We often also now see, doctor, I think back in the day, back in the older generations, if a child didn't eat, the child was somehow forced to eat. But now if a child doesn't eat, the parent hands over the tablet or a phone while watching a video. These are small unhealthy patterns, doctor, that lead to, a child having bigger risks in life. How do you encourage a parent to navigate through these challenges?
My advice, Mariela, is, the children are children, they are not, keen of, they are playful people, playful small people, small children, no? So they have various kind of things. If you get the day, they need to study, they have schooling and playing and everything, no? In between they eat whatever they can get. But if you have a kind of a timetable kind of a thing, and this is the amount that you need to eat, this much, they are not regimental kind of a thing, Therefore, I think what my opinion is, give a simple balanced diet, and as long as they are active, right? That's all what we want. So don't force feed. That is very important, especially the fast food. Of course, if you go out and have a kind of a outing, then of course you can eat liberally. But otherwise, as a routine, I think home cooked is the best form of diet for anybody, including the children.
Doctors, and what about the importance of activity and sports in children? We know it's important, but I think coming from you would endorse it more strongly, that activity and sports and being fit in the child is very important, because now children are very addicted to phones.
That is not good. That is not good. When we were small, when we were children, we never had cell phones or anything. Now of course things have changed and the technology is there, easy. They use the phone. I agree with you, Mariela, but that is not good. That is very important. You need to have some physical activities even from childhood, and a lot of schools, I mean, almost all schools, they have got a whole range of sports activities. But as you said, some parents are little, for their benefit or their easy, they give the phone and I mean, that is not good. That is not good, and it is very important at least few days a week have some kind of activities for children as well, because that is the time, as I told you before, that is the time they started their diabetes and pressure and all the high cholesterol and everything, because now after about 15, 16, 17 years, they become adults, after the exams and everything. Then they are postgraduate or something. Then they start working. Then that is the time they are under kind of a stress.
Yeah.
So the time for their activities will be a little less, between 25 to 30, like most people.
Yeah.
I mean, might as well encourage your activities, everything when they are children.
A lot of parents talk in this sense, doctor. They say we have to get back from work, so it's difficult to pick the child up after school when they stay for after school sports activities. But I think a parent needs to make an effort.
Yes, because after all, it is your child, it is your children, you have to look after them. And after all, they are going to be adults in time to come, So therefore, I think it is very important to maintain their healthy lifestyle and healthy diet pattern and everything from the childhood. That is very important. I mean, you need to balance your time between your work and between your other activities and leisure activities, as well as looking after your children. That is very important. I mean, no parents can say, I don't have time to look after my children. Then might as well not having children.
That's true. That's true, because if there is a child in your family, your primary responsibility is to make sure that the child is healthy.
Have a healthy child to the society rather than a sick child to society. It is bad for the society as well as that particular child, it is not good.
Doctor, now throughout your consultancies during this period, do you notice any children with any common deficiencies or common health problems?
Yes, of course.
Is that a trend?
Malnutrition, I mean, unfortunately say yes, it is there. That is, all nutrition are less. That is a different category. But of course, I see in the people with not the malnutrition, they have got the opposite of that,
Obese.
They are obese and they are more almost diabetes, and also their cholesterol level is high, and also some people, of course, some children, they have got a bit of a high blood pressure as well. But of course, having said that, with regard to the cholesterol, cholesterol phobia is little, I mean, it is too much, I believe, because cholesterol is, and it is an essential thing, especially the children, to develop the brain. So usually we don't do anything for high cholesterol up to the age of 20-25, because that is the time you develop your brain. Even for us, cholesterol is essential, but when it goes above the level only, start depositing in your arteries in your heart or the arteries in your brain, then you get strokes, and also when it blocks your heart, you get heart attacks, kind of a thing. So cholesterol is essential, but it is go beyond the level known, of course, that is the time then you start having the problems.
Then doctor, now we are going on into talking about adults, the young adults. How would you think their needs as people change from, the teen years to the early adulthood?
That's why I'm telling you, Marilla, that is the time that schooling is thing that you start from your, I mean, it is a very, very, very formal kind of thing, They have everything in it. You go in the morning and coming in the evening, and you have food at home and kind of thing. The moment you leave your home, I mean, after your postgraduate or your graduation, your studies or maybe your early job or something like that, then your time is different. You are on your own. Then you have to study, you have to look after your job, you have to earn, and also you need to find your food also. Then of course little busy. So again, I am telling you, still you need to have kind of a pattern that you need to do a little bit of exercises, and also the diet, and also look after your studies and look after your job. So it is an individual thing. No one can say that I don't have time, I don't have time to do these things, to exercise. But of course, when you look at their schedule, they have the time to do various other things.
That's true.
How much time you spend on your phone, how much time you spend on the other things, like might as well spend a little time with your things. It improves your health. It is important, because having a healthy or unhealthy person to a society is a burden to the society. That is not good, and that is not good individual as well.
Doctor, do you see some of the common dietary mistakes that these young adults make whenever they come to you?
Yeah.
Do you see a pattern?
Well, mostly the fast food, I would
food.
say. Fast food, and the thing is, of course, eat a lot of rice. Yes, big amount of rice, our pattern. That is not good in my opinion. And if you are a worker with do kind of manual kind of a part of your job, that of course okay. Rice is extremely good. A person who is active,
right?
But it happens with the other way if you are doing a desk job. So less rice, more vegetables, more proteins. That is the diet.
I think that's a common. I'm not sure if it's a mistake or a myth that we see, doctor. Sometimes when you're hungry, we all just attack a huge amount of rice, but I think that's unhealthy, as you say.
It is unhealthy. Rice is good. I am not condemning rice. Absolutely good. That is our staple food. That is very good. The people who work hard, I mean, good olden days, they have they take a good big plate of rice in the morning and they go to their paddy field. They do all sort of very manual hard work. That is fair enough, okay. But if you do the big plate of rice in the morning and you go for another packet of rice to your working place in a car or something, or maybe bus or something, then do some desk job there and having another meal there, right? And also you come back home in another week, same either bus or car or whatever. Then at home also you have another packet of rice or the meal of rice. Three.
Yes.
That is not good at all, Mariela. That is very bad, you know. That is, you contain a lot of refined carbs in your system. It accumulate and it increase your weight, especially your belly become bigger and bigger and bigger, you know. That is not good. The only way of have a slim kind of a figure is to less carbs and more proteins and more vegetables and less sugar and less fat.
Doctor, can you talk to us about the importance and the relationship between a healthy diet and the chronic diseases such as diabetes?
Yes, of course.
I think it also not just diabetes and pressure, but there's also other diseases like cancer also that come into play.
Most of the non-communicable diseases, that is, diseases are not spread by the, you know, and most of things are caused by the diet, especially. And supposing if you have the family history of diabetes, especially your mom and father has got diabetes, you have the tendency to develop diabetes. That of course you can't avoid, but that doesn't mean that you can't. That doesn't mean all the people who the parents are diabetes that you are going to have the diabetes. Of course, you can stop that by having a good diet, exercise, and reduce stress. That is also very important. Then you can prevent that. And also the high blood pressure, again very important. That is also caused by the if your diet is contain a lot of sugar, lot of fat, and also a lot of carbs, your cholesterol goes up. Then again is contributing to heart attacks and also high blood pressure. So lot of common diseases are caused by bad diet.
Doctor, one might say I have this particular disease, cholesterol and pressure, diabetes, and some might say I don't think working out or staying fit, it might aggravate the disease. Is that true,
doctor? No, it's the other way. Unless you have some restriction confirmed by a doctor. Then of course you have your restriction, you have a limitation of your activities. Otherwise, personally, what I feel is, if you don't have anything like that, if you are free of any other diseases, you are free to do any exercise as long as you can. There's no limit. Generally what we advise is to do at least 30 to 45 minutes exercise per day. Per day. Or maybe every other day, like 1 hour, something like that. Some people, of course, they don't have time to do it every day. But supposing if you have time to do in the weekend, yes, you do weekend for about 2 hours. Try to compensate, try to get your exercise requirement, at least during the weekend. It is important. But in my opinion, there is no limitation, my personal opinion. As long as you are tired, as long as you are not tired, you can go on doing your exercises. But on the other hand, if you have your heart attacks, high blood pressure, of course, doing exercise very good. But of course, if you have problems in your heart attacks kind of a thing, then that of course you have your limitation.
It has to be monitored.
It has to be monitored. But exercise is very important. I mean, no shortcuts. On the other hand, Mariela, people talk about various other things to reduce their weight. You know, all these what do you call all these machines,
Yeah,
and the advice in media, you know, right?
definitely.
I can endorse that. No shortcuts to reduce weight. No shortcuts, right? You have to control your diet. You have to do exercise. It's a long process. But if you maintain, yes, then when you start doing exercise and you look and when you go in front of your mirror and when you look, you are slim and it gives you a kind of a
A confidence
stimulation,
boost, yeah.
right? And it is a part of your life, you know. For me, I do at least about 3 to 4 days a week exercise, and it's a part of my life. Even my family does, my wife does, my children does. It goes down the family. It is a part of my program. Like I do everything, like, you know, it is a essential component in my life. That has to be the case, you know. It is not an optional thing. Exercise is not an optional thing. When you have time only, you do nothing like that.
No.
It is a part of your
You
life.
have to make it.
You have to make it. You have to find time, because
Yeah.
everybody has 24 hours, 7 days a week and 365 days this thing, and we don't live for 200 years, no, we live a limited number of years.
Yeah.
So you have to find time.
So it's important that
Yeah.
you know, this importance of being fit. It necessarily doesn't mean you have to go to the gym also.
No,
doctor.
not
You
necessarily.
can even walk
Not
around your
necessarily.
garden.
No,
at
not
least.
necessarily. Even if
Yeah.
you, most of my patients, what I advise is,
Yeah,
and you have YouTube, everything is there.
definitely.
And you have time to do all other things in YouTube, but not the exercise, you know. Very simple things you
Yeah.
can do in your bedroom sometimes, you know,
Definitely.
with a little bit of dips kind of a thing and some stretching, you know, you can do. There are technologies so advanced, you can learn how,
Definitely.
self exercise. Yeah.
Well, on that note, it is time we head into our first break this evening. Remain with us and we will be back. Welcome back to the show this evening, and we are talking about all things lifestyle, fitness and diet. Doctor, we spoke about the lifestyle patterns for children to adolescents, and we also spoke about young adults. Now we are going into a more trickier age, that is the old adults, the senior citizens. This is a bit of a tricky area, doctor, because the older you get, some individuals would say, I am old, now it's time for me to
So I
sit
think,
and
Maria,
relax.
I fall into that category, right? Definitely,
Yeah.
right? But I don't think I'm old, right? I do
No, definitely
all the exercise which I was doing at the age of maybe about 40 years,
Yeah.
right? I was doing the same thing. And I am also a very busy man. I do my practice, I do various other kinds of things, but I find time to do my exercises. I get up at early in the morning, 5 o'clock in the morning, 5 to 7 o'clock, 7:30, 8 o'clock. I'm in the gym at my home. I do my regular hard exercises. I mean, that's why I told you before also, there's no limit, as long as you don't have any other diseases, you have the liberty to do any amount of exercises. As long as you are tired, then you stop it, then you can go the next day. Of course, having said that, on the other hand, when you are old and when you have no other responsibilities, and you are retired, and you are retired, you are basically free.
Yeah.
Then I look at it the other way, you have more time to do exercises.
Yeah.
When I was in the Navy, I didn't have much of a time, but I was doing. But now I am not anymore in the Navy. I am a free man. But then I am doing more and more exercise more than when I was in the Navy. So it is important. So take that as a positive move. Then
So doctor, basically you're saying even if someone is in the category between 50 and above, you can still do your exercises. You don't have to say I'm old, my knees are giving away.
No. On the other hand, Mariela, doing exercise is slow down your aging. Definitely, yes, because you can't stop aging, no? Can you? You can't. You can't stop aging. It is a process, You can't. But of course, you can slow down, definitely. If you do, instead of walking into a casual walk, if you start brisk walking, all the muscles get strengthened, you know. And also if you do a kind of small weights, your bones get stronger. And also if you do some stretching, your skin become nicer, you know. So kind of a thing, you need to do all the things. So doing exercise definitely slow down aging. It is very important. And also doing exercise reduce your stress. Doing exercise reduce your weight, and it gives you a good sleep. And the most old people, they are very poor sleep. So you can have good sleep. That is very important. So it is important. Reduce your weight. That is important, isn't it? And reduce your stress. Important. And also it consumes time. And because some people, they don't have anything to do at home.
It consumes time in a good way.
Good way, yes, of course, it is in a good way. So all in all, I think exercise is always a benefit. I can't see any negative in doing exercise, not at all. And also the most of the time it is not an expensive thing, no. Doing exercise at home, sometimes you don't spend a single cent. No?
Yeah. Sometimes they say, oh no, I have no way of going to a gym. So that is one of the excuses that people.
Yes, young people, they know the doctor, I can't do because too much of sun and also maybe raining and too much of traffic, and they come out to various reasons for not going for exercise. But that shouldn't be the way. And also the other thing, remember, you have to do active exercise. It's not a passive. You know what we have done. For example, when I mentioned a person that knows doctor, we are doing all our work at home, and kind of thing, especially female. Doing household work is good, but that is not building any energy in your system. It is you waste your energy. End of the day, you are exhausted. To put up your energy, you need to active exercise. Rather than normal walk, you have a brisk walk. Rather than putting a kind of weight in this hand, put a weight on the other hand as well.
Right.
So those are things you have to do, some active, not the passive thing. Of course, we do passive thing daily. To live, we have to do. We have to walk from one table to the other. I mean that is a normal thing. That never builds any exercise unless your part of your profession is involved with some kind of activities. I mean, some people, of course, they do hard manual work. Then of course there's no need to do exercise, because they are getting everyday exercise while doing their job.
Doctor, I think the people who have to focus a lot on being fit, I think, are the ones who do a desk job.
Yes.
Mostly because you're constantly on the screen.
Yes. And especially desktop people, Mariela. Most of the desktop people, they are under kind of a stress,
Definitely.
Especially the young executives. They are under tremendous. They have deadlines, and their working hours are, sometimes long working hours, and they get the pressure from top and the bottom as well, both sides, especially the middle level people, right? So only way of reducing the stress is that, you come out of the office and at least to have at least 3 days a week, do some exercise that you enjoy doing exercise. You get the people community, especially you go to a gym or something, you get a kind of community who doing exercise. You can see them, my goodness, this man is fat, like my age, but he looks completely different from me. And you get a kind of a stimulation,
like a motivation.
Motivation, yes. So it is important.
So there is no excuse.
No excuse at all. No excuse at all.
So doctor, now with age, as people age, how does metabolism change with the age, and how does it affect your dietary needs in the older generation?
In simple terms, when you're catching up age, eat less. Eat less.
Not eat more.
No, the other way.
Right.
Yeah, the other way, right? Because anyway your activities become a little slow down with the age. That happens too.
Yeah.
And if you eat the same amount when you at the age of 40 you are eating, your activity will be less, definitely at the age of 40 or 60, 50 or 60. Then you need to eat less. People who eat less, people who never put on their weight, are the healthiest older people which I see in my practice, which I see in any practice. They are very active. They are at the age of 80, 85, thin, eat very little, but they are perfectly all right. When I ask those people, yes, doctor, I eat this amount. But when I look at the children, they are big. Their complaint is, my mom is not eating. My mom is not eating. But that has to be. Then I said, your mom is good. You are wrong. She has been. Then I tell them, don't change your diet pattern. right?
Yeah.
You have been eating very healthy kind of pattern up to the age of 85, might as well go the rest of your life.
Yeah.
But your children need to be changed your diet.
Doctor, since you brought that point out, we see the older generation, back in the time of our grandparents,
Yeah.
they had a longer lifespan.
Yeah, that's right.
Is it because of the diet?
Because of the diet, and they
were also fit. They used to walk
yeah,
from
they used
home
to
to
walk.
work.
They used to
Now
work.
it's a matter of taking a took.
Yeah, they are part of their routine. Routine daily. Their daily routine is involve a lot of exercises. They walk long distance, and they carry weight, and their stress is less. That is very important factor here. Stress increase weight.
Really?
Yes, stress increase weight, and lack of sleep increase weight, lack of activities, lack of exercise increase weight, and high diet high calorie diet increase weight. And when you increase weight, your activity is restricted, and your sexual potency goes down, and your working capacity goes down. You get high blood pressure, and you are bound to get strokes, and your cholesterol goes up. You can get heart attacks, and then you are prone to cancers, and your quality of life goes down. So.
And it also impacts your mental well-being also,
Yes,
because
yes.
People who usually work out, doctor, they tend to have a clearer mind after you're done with the workout. It clears your stress, and those 2 to 3 hours in the gym or while working out, it's some kind of solace that it provides.
Yes.
So, doctor, now I would like to ask you, what sort of tips would you like to give our older generation watching us
Not
today?
older generation. I give you the kind of a common, kind of a myth that we encounter. Eggs, eggs. Now I talk about amount of protein that we require. Protein is essential component in your diet. The protein requirement for an adult is about, I would say, 0.75 milligrams per kilogram. For example, like adult male needs about 45 to 50 proteins per day, and female is about 45 grams. So egg contain about 7 grams, and the people have fear of eating eggs. I think that is the best animal protein, cost-effective animal protein for that particular price. It has got, of course, there are some disadvantages, but the phobia is I think it is not. It is what you call shouldn't be there. And egg yolk has got choline, that is good for the brain, good for the skin, good for the eyes, and also whole range of vitamin B, vitamin A, selenium, zinc, phosphorus, magnesium, iron, and you name anything, like it has got. And also the egg white has got protein. So if you divide all these components, and if you are going to buy from the pharmacy, it costs you about at least 2,500 rupees. Definitely. But you get a.
This might seem a little controversial, doctor, but do you think, I think back in the day, they didn't have this concept of taking whey proteins and supplements. It was a matter of the food you take. But we see a lot of people, even gym enthusiasts, sort of resorting to using, protein and pre-workouts and different things. Do these have side effects, doctor?
Well, Mariela, my personal feeling, personal opinion is, if you need to have a good protein, might as well have eggs are very good protein, as I said. Your requirement is about 50. Supposing if you need to have a little bit of muscle, building your muscles and all, you can add in addition more and more protein. So having 3 and 4 eggs a day is fairly okay. And the fear is to increase cholesterol. If you increase cholesterol, check your cholesterol every 3rd or 4th month or 6 months or something like that. Then if the cholesterol is high, you can have either atorvastatin or rosuvastatin capsule for a few days, few months. Then it is gone, But advantage of having eggs is very important, because that is the best animal protein in my opinion. And answer to your question is whey protein. Those are processed proteins and come in very bulk, large packs. My personal feeling is, whatever they mention in their labels, of course that has got bit of a steroids, androgens and kind of thing. That's why within no time you put on like nothing, That shouldn't have happened. I mean, that usually doesn't happen with normal protein. And also pre-workout, of course, people take. My opinion is, unless you are a professional bodybuilder, your income is showing your muscles and earn money, then of course okay. But otherwise, best way of have your protein is
The
either fish
natural
or
way.
meat or eggs. That is
Through
the best.
food.
Or food.
Because back in the day, doctor,
Yeah.
none of these were even available. I
agreed.
think it
Yes.
wasn't even heard of.
Yes.
So we're heading into the next segment, and that is the importance of having a healthy lifestyle and a proper diet for pregnant mums. So this is also, doctor, a tricky area because of course being a pregnant mother, there are complications that come in, and of course mother to mother it varies according to the situation, and but I think having a decent amount of exercise would not harm the mother and the child.
Not at all. Exercise is encouraged. There are certain form of exercise that even YouTube you can find for the pregnant women, and the diet is again the balanced diet. Of course, you need to have more and more protein. Again, you need to have less carbs. I mean, if you get a head-to-head comparison, there's no change between the what do you call the non-pregnant lady from a pregnant lady. No, there's no difference. Of course, you need to have more kind of proteins. So that is my personal opinion. And also you need to take a little bit of iron, because your iron count tend to drops, and also the folic acid. So generally the people, I mean all these gynecologists, they give pregnant women that iron tablets and folic acid, most of their supplements. Otherwise it's a simple, straightforward, healthy, balanced diet for pregnant women.
Doctor, there is a myth or a sort of a statement that I've also heard and come across. They say when a pregnant mother sort of has a consistent lifestyle of being fit, doing regular exercise, that the birthing of the child is easier than an average.
Yes,
is that true, doctor?
Yeah, that is true, because having a child and delivery is a natural process, no?
Yeah.
It is not disease, no?
Yeah.
Right? It is not disease, right? It is a normal process.
Yeah.
I mean, and doing exercise definitely helps, especially when a mother carrying a baby in a tummy, and it is an additional weight, But if you do exercise and stretching kind of a thing, it really helps to stretch these pelvic muscles and the legs and back muscles and everything. And especially when you go into labor, it really helps you to ease out everything and have your childbirth pretty easy. That happens. And also the maintaining your weight is very important, even the pregnancy. When you're carrying a baby in your tummy, of course your weight increase. That of course you can stop, no. But of course that doesn't mean that you're overweight. If you're overweight, everything is problem. Even for a delivery is difficult, and also having a cesarean section, if you go for a surgery, that is also difficult. Everything is difficult. And also when you have your weight goes up, sometimes you tend to get pressure, and sometimes you tend to get protein in your urine, and it is a pregnancy associated complications.
Right.
Then both mother and both baby
child
are
at risk.
Yes.
So, doctor, now in terms of food, of course, the gynecologist will give certain dietary restrictions. Is that a correct statement? Or can a pregnant mother, sort of eat whatever she wants?
No, that's okay. I think as long as she is not diabetic, as long as she is not high blood pressure or anything. Of course, we are not worried about cholesterol during pregnancy, because we need to have a lot of. Pregnant women, they have high cholesterol. So there's
really? Is that just during the pregnancy?
During the pregnancy, also just after the pregnancy. You know that when a baby is born, first few days of mother's milk is not white, it is yellow.
Right. Yeah.
And we call it colostrum. And colostrum contains a hell of a lot of cholesterol.
Right.
Why? Because that is the requirement for the baby to develop the brain. That is an essential component. So I think high cholesterol in pregnant women, generally we don't treat, unless they have got some heart issues or something. Generally we don't.
So saying, doctor, it is a natural fluctuation.
Natural fluctuation, yes. Cholesterol is essential component to develop the brain.
I've never heard of saying.
Yes. That the young people, they need cholesterol.
Yeah.
They need cholesterol. Yes.
So, doctor, now since we spoke about the importance of having a healthy lifestyle for pregnant mums, and especially going into that transition period is very tricky. So I think all of us at some point of life, or maybe every day in life, deal with some sort of stress, whether it's work, education, or even a tender child of about 5 might have the stress of not having the toy of his choice. But doctor, I would like to ask you, how do we deal with stress?
Well, stress is very subjective thing, Mariela. Now, some people, they get stressed out for very pretty things, you know.
Yeah.
And some, of course, they have got all the problems in the world, but they are not stressed out. Personally, I never get stressed out.
Yeah.
My work, but I get stressed out when something happen at home, very small things, you know. That all depends, you know. It's a spectrum, and stress is part of it. Like, you need certain amount of stress to live, you know.
Yeah.
Because you need to have a little bit of adrenaline to live on, you know.
Yeah.
You need to have a little boost to do something, no. It is a kind of form of stress, but when you go beyond that, only it become a problem. One way of reducing a stress is, and people do various things.
Yeah.
What I personally do is, I do my exercise, and I do involved in my hobbies, you know, singing, my photography, and kind of thing.
Yeah.
And that is one way of relieving a stress. I mean, I don't think there is no person in this earth who is not having stress. Of course, everybody has certain amount of stress, and also is within bracket. It is how do you
handle it.
And
it is important how you, I think each person finds their way of coping with it. So everyone has to find their own coping mechanism. Some people, doctor, perform well under stress.
Yeah, that's right. That's what I'm telling you.
Yeah.
We need to have a little bit of stress to, you know.
Yeah.
That's why people get their, you know, their targets, you know.
Yeah.
When you have target, only you achieve that. Having a target is a form of stress, isn't it?
Yes.
But of course, when you achieve, you get kind of a, you know, real satisfaction and achievement. Yes.
Doctor, these are some floating questions that we often hear. Now, how important is it for an individual to going to a hospital or meet a doctor for preventive health screenings? How often should
that is very important.
Be done?
That is very important. That is very important question, because rather than waiting to find a disease on you, so especially the people who have got the family history of diabetes, family history of high blood pressure, and also if you are not a very active person, and also if you smoke, if you drink a lot of alcohol, and if you are not doing any physical activities, right, and if you are under tremendous stress, of course, that individual need to go very often to hospital and get your blood pressure check, and or meet your doctor, and your cholesterol check, blood sugar, liver function, kidney function, routinely at least once a year, like.
Once a year.
Once a year. On the other hand, if you don't have anything, if you are not obese, if you are perfectly all right, your body mass index is okay, if you don't have any family history of diabetes, pressure, and no significant problem in your family, you don't smoke, if you don't drink much alcohol, if you do regular exercise, you are not under tremendous stress, then of course at least once a year, or maybe once in 2 years or 3 years, you can have your basic test done.
Doctor, does this preventive health screenings, does this apply just to the people of the older generation, or people even of the 20s, 30s?
More than the older generation, Mariela, I think it's not the 20s, I would say. But of course, when you start at the age of 30 to 50 is the worst age group, because they are under stress. That is the time you start your career, and you are under stress. And that is the start your family. That is the start your looking after your children. The transition period is very important. Of course, old people, they are free, and their system is adjusted. You know, if you get the people, old generation, for example, over 60, the prevalence of heart attack is very less, because their heart is, you know, more or less adjusted to the system. They have a lot of supporting circulation in their heart. Therefore, the worst age is, I would say, 40 to 50, like, you know.
So it doesn't matter what age you are, but get checked once a year.
Yes.
There's no harm in it.
No harm.
Yeah.
I mean, you have the places, you know, get your blood sugar checked. Blood sugar is very important, because most people that they never thought they have diabetes unless they are getting checked. Yes. Of course, you have symptoms like you reduce your weight, you pass a lot of urine, and you feel thirsty and kind of thing. But of course, my opinion is get your things checked regularly.
Before my final question to you, Doctor, I would like to ask you, what are some of the common myths that you would like to dispel when it comes to diets and lifestyle?
Well, as I said before, I would say there are no shortcuts to reduce weight. You have to do exercise and the diet control, and also the again I am telling you as eggs.
Yeah.
Even our children give no harm. Parents, I advise parents to give eggs as much as they can eat. There is no problem with that. It is very important to eat. Improves your skin, improve your eyes, and improve your brain, and is good protein and healthy protein is very important.
And having a healthy child doesn't mean the child has to be
No, it
obese.
has to be the other way.
Yeah.
Healthy means active and a proper body mass index, BMI. It is between 18 to 25. Less than 18 is underweight, more than 25 you start your overweight, more than 30 obese. So very easy to measure your height in meters, or rather weight in kilograms divided by height in meters in multiply by same. Then you get your body mass index. Very important. Have your body mass index under control. It is important. You can do that. And remember, as I said, increase weight is very fast, but reverse is very difficult. Especially belly, tummy.
Yeah.
And I don't think anyone would like to have big tummy. I don't think people carry with big tummy. Of course, I think they are always under all the activities are restricted, and also the thing, Mariela, this increased weight can cause a lot of other problems, including what you call the obstructive sleep apnea. They snore at night, and their carbon dioxide is increased, oxygen is less, and they tend to get heart attacks, strokes, and again their sexual potency goes down.
So that means, doctor, snoring is actually an indicator.
Snoring is an indicator. And huge is a problem. Is a tip of the iceberg. We have seen the people with snoring. Other thing is, snore people, they don't sleep well. People feel that they snore well. It happens the other way. Why?
Right.
Because sleep has got 4 stages.
Okay.
Rapid eye movement. So before they go into the 4th stage, how they snore is they do like that. Then all of a sudden they stop their breathing. If you carefully keep looking at a person who is snoring, they snore and they stop.
Yeah.
That means they stop breathing. Then their carbon dioxide goes up, oxygen goes down. Then automatically you get the brain signal that you wake up, otherwise you will die. Then all of a sudden they wake up. Then again you do the same thing. So the whole night before they go into the 4th stage of sleep, they wake up and sleep, wake up and sleep, wake up and sleep. So end of the day, that particular person who snore was not sleeping, neither person who next to also not sleeping because of the noise.
Yeah.
So both of them are awake, And next day morning, when you start your work, you feel very drowsy, sleepy, and it is one of the common reasons for road traffic accidents. Because in the morning they get dressed and they drive their vehicle. The moment about 9:30, they get sun on this thing.
Yeah.
They sleep
so
on
basically, doctor, all of this is connected.
Everything is connected. Yes.
Everything has a reaction to whatever you do, starting from the meal you take when you're a child.
Yeah.
Up until your very last day on earth. So everything has a reaction.
Yes.
So doctor's time is ticking. I think we would like to hear your parting message to everyone watching us today.
Well, my opinion is diet is to live, and to maintain that you need to do exercises. Don't give excuses for not having healthy diet, and also not having time to do exercises. But after all, illness and when you're sick is very expensive thing, and also it is a painful thing, because whatever the money, Mariela, you have got, the moment you fall sick, that pain and agony and everything on your own. No, you can't give your pain to anyone else. So of course, if you have money, you can spend any amount of money, but still the pain and the stress. Why go through? Right? Why go through? Because what I have been telling right throughout is not very not very expensive things. In fact, it is the other way. You save money.
It's an investment.
It's absolutely
a long-term investment.
Long-term life investment, I would say. Lifetime investment. Yes, agreed.
All right, Doctor, thank you for joining us today. And Doctor has been with us on the show previously as well. Last time we spoke on gastritis,
Yes.
if I'm not wrong. So, Doctor, thank you once again for joining us and wishing you nothing but the best.
Thank you, Marila. Thanks for having me.
So, I was in conversation with Surgeon Rear Admiral and former Director of the General Navy Health Services, Dr. Lalith Ekanayake. On that note, it is time we close for today. Join us again next week for a story that will ignite change. Until we meet again, stay safe and have a pleasant night.